And I think it really is only as the realities of demographic change in terms of the number of older people there are and the proportion and the number of people who are young and of working age who are disabled increases. Everyone, including the government, tells us it's not going to be until that kicks in as a reality and a political reality that the serious efforts to make change, the fundamental change that we know has to be made, will be made. So we will have to wait for that grey vote and that disabled people's vote, I think, to get some serious success in addressing social care as we are told it must be addressed.
We've been talking to nurses for quite some time now about the interface between health and social care, and reflecting back what they say to us on a regular basis is that they are pleased to see the recognition that there's a crisis, they're pleased to see explicit recognition about the increase in demands. But what they come back to is, we're living this now. We're dealing with some problems and major issues now. We're not sure how this is going to help us and fix these issues over the next 3 or 4 years.
For local government, this is the single biggest political question at the moment, and for the LGA, we have demonstrated that by adopting for many years now a cross-party approach to the need for reform and the need for consensus, simply because it is a long-term issue. We've attempted to engage with our political bedfellows nationally in the House of Commons and indeed the House of Lords, and we shall continue to do that.
There are no very strong formal levers for integration in the Health and Social Care Act or indeed in the Social Care White Paper. So an awful lot of premium has to be put on the quality of local leadership and on uncertain mechanisms like health and wellbeing boards.
Just a couple of examples of the things which regularly come up are nurses who work in the acute sector who get hugely frustrated with delayed discharges and being able to move people out into community and social care. The other issue that they talk about, and I'm mindful not to stray into the funding issue, so I'm going to concentrate on the eligibility issue, but is the discussion between health and social care staff about, is this a social care assessment or is this a continuing health care needs assessment? Can you reassess on the basis of whether it's continuing health care needs?
I agree with those who have said that this should not be a case where social care is looked at in isolation. From the point of view of the individual who needs services of one sort or another, they are often unclear about where that border is, that boundary is between health and social care. We all know that some of the resources that are going to be needed are currently in the acute sector within the NHS.
It's encouraging that the White Paper makes reference to some further work that the government intends to publish by the end of this calendar year on a plan for integration. So I think all of those who have an interest in that ought to be badgering the Department of Health to allow us to be involved in that process. I think that a lot of the scope for integration is going to rest on a focus on outcomes, a focus on people's experience across the journey of care, and on sensitive and skilled leadership.
The biggest failure of integration, I think, which is not addressed at all by this government or by the White Paper specifically, and perhaps not adequately by other commentators either, is the degree to which there is any understanding of the need to integrate social care policy with welfare reform policy. And these two are heading in what seem to many service users fearful and very opposed directions. The rhetoric is very positive, of course, in the White Paper, and all the ideas of partnership, empowerment and involvement are still strongly in there. However, we may feel concerned about the likelihood of them being seriously addressed. But that's not the case for what is essentially pretty much the same population when it comes to welfare reform.
If you look at where the nursing workforce currently sits, where it works, the overwhelming majority is in the acute sector. Only about 25% of nurses work in community primary care type roles. There is, I think, a very compelling case that one of the areas for better integration, closer working, one of the areas we need to focus on is getting staff into the right place. People may be having shorter lengths of stay in hospital. That doesn't certainly mean that their care needs when they go into a home or another area become less complex and simple.
if it continues the way it appears to be at the moment until 2020, which is not that far away, we're only talking about 7 or 8 years, there will be a £17 billion per year black hole in local government finances, and the resources available for all the other services, whether we're talking about libraries or road maintenance or leisure services or any of the other great diversity of services that local government is involved in, those will have shrunk by 90% in cash terms, simply to meet the growing demographic pressures that we've already heard about from other speakers in relation to social care and of course waste, which is the other big issue that hardly anybody ever talks about, but the costs that involved there are very considerable as well.
We must begin, instead of ducking the question, to investigate seriously what the issues are for approaching funding out of general taxation. And service users, when they repeatedly say that's the only way this will work, it's the only way we'll get integration, they're not just saying cough up more money out of general taxation, they're saying the whole system of health and social care needs to be reviewed.
I think there is now an opportunity to step up making the case for reform. We mustn't wait for Dilnot, that's like waiting for Godot. I think we should be rolling up our sleeves and first of all working out who we need to influence, which I think is the Treasury and number 10 in terms of government, not the Department of Health, who violently agree with most of what's being said today, I think, but their hands are tied. We need to make the business case for social care funding reform, which I think is essentially that if we don't sort it out, we bankrupt the NHS. So it's absolutely about health and social care together.